Next question. Everybody here tonight has talked about how important education is. What changes need to be implemented, if any, to improve our educational system in Carteret County and indeed across the entire state? We are going to start with Mr. Harris this time.
Education. Education is that other flip side of what we do as a state government. I'm sure most are aware that somewhere between 58 and 60% of our entire state budget goes to our educational system. That is an enormous amount of money. And it's going to a system that is crumbling and failing. And it's easy to try to say, well, we need to throw more money at it. The two parties that currently hold the legislature, they have two different ideas. One says, don't throw any more money at it. The other one says, pay teachers more. Neither one is going to get us anywhere as far as fixing our educational system and providing a quality education to our children. And the problem is structural. The problem is not the amount of money that we put into it. The problem is that we are fundamentally doing education incorrectly. We have not built an educational system that can effectively teach our children the way children need to learn. What we're attempting to do, what we've been attempting to do since World War II, World War II taught us that big government and aggregated industrial processes work. Turns out they don't work for teaching children. And it's taken us 6 or 7 decades to finally figure out that this is an abject failure. We need to fundamentally rethink the way we do education. I support and complete dismantling of the way our Department of Public Instruction functions. We need to dismantle our large aggregated school systems. Children are not built socially, psychologically, to function in social groups of 700 or 1,000 or 12 or 1,500 people. All of the evidence shows the smaller the school size, not class size, the smaller the school size, the higher the educational outcomes. Anything that we're doing, we put a lot of money. We have arguments about how much money we should be putting into mental health intervention in our schools. Anything we're doing in our schools is requiring mental health intervention. We're breaking our children. We need to do it better, and we need to do it right, and we need to fundamentally stop and do it differently than we have been.
Thank you, Mr. Harris. Mr. Bailey, same question.
Well, again, I'm going to take the other side on that. I think the Carteret County schools are doing a great job. They get great grades on their test scores and so forth. But what we've got to do is we've got to help them sustain and grow in what they're doing. We've got to pay our teachers better. We've got to recognize teachers. The administration took away increase in pay for people who worked to get master's degrees and doctorate degrees. They no longer recognize people who put in hard work to become good teachers. The infrastructure of our schools, some of them are crumbling. They got to put money into those schools. I think the teachers here should be applauded for the wonderful job they've done. They moved from one day of having kids in a classroom to having kids online. And they made that trip. Hats off to them for the transition that they made on that. I don't think our school system is broken. We need to help support them and improve it. At one time, the school systems here in North Carolina were a model that other states across the nation looked at. Now, with all the cuts they've done to the teachers and so forth, we're down at the bottom quadrant. So we need to, again, invest in our schools, invest in our kids' future. And I would support doing that if I'm in office.
Thank you. Norman Sanderson, same question.
Okay, thank you, Tom. You know, we have 99,000 teachers in North Carolina. And I would say without hesitation that 99.9% of them are good teachers and are doing a remarkable job. Carteret County does do a remarkable job. They have gotten themselves or found themselves in probably the top 5 or 6 school systems across the state of North Carolina. And it's because, first of all, for many things, first, they've had good administration at the top. They've had a good working relationship with the Board of County Commissioners. The Board of County Commissioners does an exceptional job in helping give stipends, or it has another name, but more or less supplementing teacher pay. There's a lot of poor counties that can't afford to do that, but Carteret County has been able to do that, and it's put them at the top. Our school system across North Carolina is about 47, 48% minorities. We've got to do a better job in bringing those minority students online, get them at a higher place in their academic careers. It's not an easy thing. I know that we are moving in the direction of bringing our North Carolina teachers to a higher paid scale. And it's something that I really think that we need to do. And we've done a remarkable job, I think, in the last 6 or 7 years in giving pay raises every year. Could we do more? Do we want to do more? In other words, yes, we want to do more. But we have a limited amount of money that we can spend, and we have to put it to where it's the best used. We've done a lot of programs. I'm an advocate of parent choice, parental choice in education. I think that parents need to have the ability to choose where their children go to school, or if there's another form of education that will help them better. And I think that the money needs to follow those children. And so, we are making progress. It's slow, a lot slower than I would like to see it, but we are a lot better off than we were 10 years ago when I came into the government.
Thank you, sir. Ms. Griffin, same question.
People who have just arrived in North Carolina may not know that most of our education money comes via the legislature. The decisions are made, budgets are controlled at the statewide level and not from local taxes and not by the local school boards all the time. Of course, school boards have a big role to play, but they don't control budgets necessarily. In 2013, the Republican Party controlled all 3 branches of the state government for the first time, and they immediately began shifting school money to private schools via the voucher system. Last year, $37.7 million were taken out of public schools and given to private schools. At the same time, our public school system fell from a high national ranking to the bottom nationally. Educators were denied raises. Many of them had tenure taken from them. Many teaching assistants lost their jobs. As a result of bad treatment, many teachers left the profession or left the state. Classrooms became overcrowded. School buildings have not gotten the maintenance and repairs and replacement that they need. Conditions in our public schools are dire, but there's little support for public schools in North Carolina from the legislature. I think parents and others are very concerned about the kind of educational system that we have now, and I think we'd all like to see it improved.
Thank you. We're going to stick with education for just a minute. Carteret County is extremely proud of its community college. How important are community colleges to you and why? Ms. Griffin, we're going to start with you this time.
Well, I'm not very familiar with Carteret Community College, so I understand it's quite good. I am familiar with Craven Community College and the way it's grown in the 20 years that I've lived here. There's a great deal of cooperation with Cherry Point. There's a whole separate facility right next door to Cherry Point where people are trained to maintain aircraft and other things. At the college itself, there's a college for high school kids, I guess is what it's called. All kinds of job training, plus a liberal arts education for the first 2 years of a student's education. I think it's one of the most valuable things in North Carolina in terms of the future for our young people. And I think it deserves all the support it can get. I'd like to see perhaps a bit more liberal arts than at least Craven has, but there's some. And the kids get the basics. So I'm rather happy with the whole community college system. I think it's a good idea. I will say that where I came from, it wasn't like that.
Thank you. Mr. Harris.
Our community college system is absolutely vital to our statewide higher educational system for a number of reasons. First and foremost, this is where children who are coming out of our high schools who are getting only a college preparatory curriculum degree or diplomas are going to have opportunities to discover the other avenues in life that may not lead to or need college. Unfortunately, our high school system is doing a terrible job of preparing them for making that decision. Community colleges provide workforce development, as Ms. Griffin noted, and that's especially important here in Craven and Carteret and Pamlico counties because of FRC East and Cherry Point. More importantly, our community college system is, I believe, a bridge. I believe most people who are coming out of high school need to have had a better sense of what they actually need college degrees for. I do not believe and will never support the college degrees for everyone idea that's been pushed on us by past presidential administrations. That is debilitating and it's costly. But the community colleges provide opportunities for people who might need to discover where they need some more education but don't need college degrees. They provide opportunities for people who need trade degrees. Trades are something that we are terribly deficient in. Our service industry and service economy are going to go through slumps in the next decade if we are not finding and educating and developing tradespeople to take over from the generation of tradesmen who are retiring and getting out of their fields. There's already a dearth all over the state of trades and people to fill those positions. And most importantly for children who are going to college, community colleges are a great way for them to save money. Instead of doing their first 2 years, getting those done in the community college system. So as far as I'm concerned, it's absolutely vital and we must fund it.
Thank you. Mr. Bailiff.
Okay. Well, I agree with Mr. Harris. Our community college that we have here in Moorhead is a real jewel. And we should be very, very proud of it. I know people are. We need to support it and help it grow. As was mentioned, there are kids that just are not college bound, but they do want to go beyond just the high school level. It gives an opportunity for them to go somewhere and learn trades, learn skills that they can do something besides just working in the hospitality industry or working on the farm. They can, and there's nothing wrong with that, but it does give them an opportunity to grow beyond what they had in high school and learn some good skills. So yes, I'm very much in favor. I'm very proud of our community college, and we do need to continue to support the community college and help it grow.
Thank you. Mr. Sanderson, same question.
Okay, thank you, Tom. I'm thrilled that we have finally gotten to a place in the education system that we have made the decision, and I think we were forced to make the decision that everybody that comes out of the 12th grade does not have to go to a four-year institution. There was a time there, I think, when the community colleges had fallen into that, and some of them were more of incubators for four-year degrees than for two-year degrees. And I'm glad to see that's changed, has changed, and it's changing even more. I think we have three of the best community colleges in this district, anywhere within the state, and I would hold them all three up against the state. I know here in Pamlico, our community college is the smallest one in the state and probably smaller than most across this nation. And yet they consistently rank up in the top 5 or 6% of the type quality of education that they are giving their students. And community colleges have a unique ability to fashion curriculum to meet the neighborhood that they are in or the counties that they are serving. And that's unlike any four-year degree. A community college can put together a curriculum, hire a professor to do it part-time, and have a program up and running in just a few weeks, where in a four-year university it would take many, many months to get something like that done. The cost is phenomenal as far as the quality of training that they get for the money that it costs them. They can go, they can stay at home, they can work side jobs, and they can come out of community college with little or no debt Whereas in a university system here, right here in North Carolina, you can go to a four-year institution and come out with 30, 70, 100, $150,000 worth of debt that you have to start paying immediately. I know that our community college system has the ability to become even better than they are. And I'm looking forward to giving them more money than we're currently giving them to develop these programs. And we need to take a little of it away from some of our four-year state-supported institutions and give it into the community college system.
Thank you very much. I'm going to combine two questions here. So I'm going to try to do this as succinctly as I possibly can because they both refer to the same thing. In Carteret County, our Broad Street Clinic, which is our free clinic, estimates, and this is before the pandemic, as many as 1 in 4 people do not have health insurance. At one point in time, the North Carolina Healthcare for Working Families Act had bipartisan sponsorship, but seems to have stalled in September of last year. Where do you stand on expanding access to healthcare coverage for low-income North Carolinians? We're going to start with Mr. Harris.
Healthcare coverage for low-income North Carolinians, as it is for low-income citizens of any state, is not something that we can effectively mandate from the state, from the legislature, from Raleigh, and say everybody or these X number of people are going to have healthcare coverage. I know Medicare expansion has been on the table. There are costs associated with that I'm not certain that we as a state can bear, considering our current budget. I see the healthcare issue as one of a matter. The access is not, people like to say healthcare access as if there's a gateway and some people are controlling it, and some people can get through and some people can't. In reality, access is a function of price. And the price in our healthcare system, what's preventing people from having healthcare is the fact that they're priced out of the market. They simply can't afford healthcare because we have a system right now where the federal government is subsidizing healthcare, and what happens whenever the government begins subsidizing things, the prices rise. We have a system right now where we have people disconnected from what's being paid for goods and services in their healthcare system, and we have massive overcharging for goods and services in the healthcare system, and most importantly, we have reams and reams of statutory corruption, to put it bluntly. We have legislative fraud that over the decades has built barriers to entry for service providers, barriers to entry for healthcare insurance providers. These barriers to entry, these controls over who can provide what services where, under what conditions, fundamentally keep healthcare more expensive than most people can afford. If we remove those barriers, if we allow a free market in actual healthcare service, goods and service provision, the prices will begin to drop. And that's where the access begins. If we are taking the money, the big money out of the system, we are allowing the little people and the little money to have what they need.
Thank you. Ms. Griffin, same question.
I'm entirely in support of expanding Medicaid. I'm also entirely in support of Obamacare. I think that we have a stronger opportunity, a larger opportunity for more people to be covered. Buck said earlier 500,000, and I've heard that number, but the number I've seen lately is 626,000 more North Carolinians would gain access to health care if expanded Medicaid was approved. The cost of everyone's health insurance would go down because today those of us who have insurance have to cover the cost of those who are treated in our hospitals and other places, but have no insurance of their own and can't pay for it. But besides that, we would gain $36 billion in the next 10 years in jobs that are coming not just from expanded Medicaid and doctors' offices and hospitals, but jobs that grow from the increased income people who work in those jobs have to spend in the rest of the economy. So basically, it's a win-win situation. There's no reason not to do it. 3/4 of the states have done expanded Medicaid, and we're very behind on this one.
Thank you. Norman Sanderson.
You know, if there was one path to totally revamp our healthcare system, it would be very simple. But it's not. It's got to be a many-pronged path. It's got to be the fraud issue, like Mr. Harris said. It's got to be price transparency of cost of actual medical treatments. It's got to be the drug situation that pharmaceutical companies cannot exorbitant prices for drugs. It's got to be, it's got to be to expand into areas that technology is making available to us right now. I'm working on and being very active in telemedicine for North Carolina. Again, I think that's going to help our rural areas where they don't have to try to get access. Medicaid expansion sounds like a cure-all, but I think it brings along with it just as many problems as it might solve. If you look at the data that tells you who would be on these Medicaid rolls, this new influx of patients, there's a whole lot of them that we just need to help them get a job, and so that they can find their own health insurance instead of the state of North Carolina trying to do that. You know, it just makes common sense that, first of all, there's not enough doctors to handle 500,000 new patients. There are a lot of doctors right now that are not even taking new Medicaid or Medicare patients because of the low amount of money that they receive for their services. We were very well close to changing the whole Medicaid system in North Carolina as a fee-for-service instead of just just a broad approach. It will save hundreds of millions of dollars if we can make that happen. You know, we have to take what we have on the table and try to fix our medical situation, and not bring in something that we think is going to cure all, because there's a lot of states that have found that that is not a cure all, and it's brought just as many headaches as they can.
Thank you. Mr. Bailiff, same question.
Well, one of the things that we can look at in approaching this for the healthcare is we also have to look at the income inequality here in the state. 14% of our North Carolinians live in poverty. 22% of the children are listed as poor. We are the 12th worst in the United States with people living in poverty. So we've got to work to help these people to pick themselves up and get good, better paying jobs so that they can help support themselves. And then again, I'll go back to we've got to expand the Medicaid. The help that will give to our communities and the relief on the hospitals. When these people get sick now, they go to the emergency rooms because they have no doctors and they have no means to pay. So that's an expense right there. We've got to look at pharmaceuticals and how the price on the pharmaceuticals. If you're diabetic like I am, you've seen your medicines go up tremendously over the last few years. So we've got to get that under control. The Medicaid expansion is, again, I'll just stand by that, the money that it will help bring into the county and help these people.
Thank you, Mr. Bailiff. Over the last few years, North Carolina has been punished by a number of hurricanes. This year, Louisiana seems to be the target, and I knock on wood, hoping that this is the last one of the year, and of course that North Carolina doesn't see any bad storms. We've also seen that these hurricanes can affect the entire state. It's just not a coastal situation. But how can we be better prepared for hurricanes here in North Carolina? Let's start with you, Mr. Bailiff.
Well, hurricanes are an interesting thing. I don't know. I'm not sure I know how you'd be better prepared. We do have to, though, listen to what the scientists are telling us. We've got to listen about climate change. Climate change is real. We've got to look at things like the sea level rise, where, you know, I know we had a House bill that did not listen to the science about sea level rise. Well, here in Carteret County and Beaufort, just last week with some high tides, we had public streets that were flooded. So we've got to look at that. We've got to look at how we're building in these areas. We can't go in and just rate the land down and put buildings up for profits. We've got to look at the effect that that has on our environment. Putting in highways and the runoff from those highways, how it affects our climate change. So I'm a big proponent of looking at climate change and listening to what our scientists have to tell us in regards to preparing ourselves for hurricanes. And when they tell you to get out, it's time to get out. Don't try to ride it out.
Thank you. Norman Sanderson, same question.
Well, and I'm glad you mentioned it. Louisiana is sitting right square in the eyesight of another Category 4 hurricane that is supposed to come ashore there sometime tomorrow. North Carolina has had its times with hurricanes, 2 and 3 a season. I've been praying all season long that we're spared this year so that we can rebuild our savings funds so that we are able to help like we have in the past. The last storm that came through, I think we spent over $1 billion in conjunction with the federal funds that came. And so, one of the things that we need to do, I think, is we need to look at our rivers. We need to look at the places that need attention as far as getting the water where it's supposed to be, when it's supposed to be there. The last time we had so much flooding is because we had a hurricane that stayed here about 7 or 8 days, and it never would allow the rain from upstate to get here because it kept the tides in the sound so high. Those are some things that there's not in our control. How do we prepare better? We have to have better ways to communicate with people. We have to continue to fund our emergency people who go in and rescue folks. We do need better prepared shelters for people to go and to stay in when they have to leave their homes. There are some things that we can do to prepare. We can't ever deflect a hurricane except through prayer, and I've seen a lot of that happen also. But we just need to understand that hurricanes are a part of living on the coast, and that when they do come, if they come in our direction, then we can do things to be prepared. And that's just not to get caught off guard sometimes like we do. How do we get electricity to people quicker than we have? How do we get people transported out of low-lying areas where you know it's going to flood? And so those are the things that I think we have to look at, not a cure, but we have to look at what we can do during and after a hurricane to make it easier on our citizens.
Thank you. Ms. Griffin, same question.
I'm a Yankee. I'm not so sure I'm as familiar with hurricanes as the North Carolinians here. But I do know that I have had substantial damage to my houses that I found it very difficult to prepare, except to leave. I did take my 90-year-old cousin and leave when Florence came. But I think that what we really have to think about is global warming, which is very real, and an awful lot of people just simply won't accept that. The ice in the Arctic and the Antarctic is breaking up and melting, and the oceans are getting deeper and the water's getting higher. And until we begin to recognize that and make genuine changes in the way that we dirty our air and pollute our world, I think that we're going to have to be prepared to deal with things like Hurricane Florence. I wish we didn't, but I don't know that there are a lot of better ways to avoid it.
Thank you. Mr. Harris.
Hurricanes, our response as a state to hurricanes needs to be divided into two things. As Ms. Griffin and Mr. Bailiff mentioned, climate change is a factor in hurricanes and our hurricane response and what's going to happen, but that's a long-term thing. It took us decades to get to the point where climate change is creating more consistent hurricane damage. It's going to take us decades to fix that. So the question we have to address now, right now, is how do we band-aid the problem for the time being? How do we provide the goods and services and security for the citizenry in the meantime? And I can tell you, I spent my younger years right out of high school in the United States Marine Corps. And I did 2 deployments on what's called a Marine Expeditionary Unit. And a MU has a couple of functions, but one of its primary functions is humanitarian and refugee and emergency services relief. MU was trained to be able to go into an area and provide defensive support, refugee camps, to be able to clean water, provide clean food, transportation for refugees and large amounts of people. Our state needs to have this mindset. I'm not saying we need to have MUs, but we need to have this mindset that our state needs to be setting aside supplies and services stockpiled in the eastern lowland regions of this state, all the way up to Raleigh. We need to have equipment that's capable of surviving high stress maritime water flows, large trucks, vehicles. We need to have electrical power generation that we can provide, put on site in cities. I was here in New Bern during Florence, and we went for a week with no power. We need to have relief money set aside to help people get their houses back in order. I have a friend who just 3 weeks ago moved back into his home after Hurricane Florence because we simply don't have enough contractors in this region. Again, this goes back to lacking tradespeople. We don't have enough contractors in this region to get those repairs done. Short term, we're going to have to put actual effort into providing services on the ground.
Thank you, Mr. Harris.
Mr. Harris.